Glaucoma silently steals sight without warning. As an ophthalmologist with 15 years of experience, I've witnessed too many patients discover their condition too late. My own grandfather lost his peripheral vision before anyone realized what was happening. When he finally came to my clinic, I felt helpless seeing the advanced damage. That day changed how I approach patient education forever. His experience taught me that awareness is our most powerful weapon against this silent thief of sight. Glaucoma affects over 3 million Americans, yet half don't even know they have it. This progressive eye condition damages the optic nerve, typically due to increased pressure inside the eye. The most devastating aspect: once vision is lost, it cannot be restored. Early detection and proper management are your only defense. The science is clear. Glaucoma damages the optic nerve fibers gradually, beginning with peripheral vision loss that many people don't notice until significant damage has occurred. Research published in the Journal of Ophthalmology shows that up to 40% of optic nerve fibers can be damaged before changes appear on standard visual field tests. Everyone faces some risk, but certain factors significantly increase your chances. Age over 60, family history, African or Hispanic ancestry, and certain medical conditions like diabetes all raise your risk profile. But don't lose hope. Taking control is possible with these 5 critical steps. Step 1. Schedule comprehensive eye exams regularly. The American Academy of Ophthalmology recommends a baseline eye examination at age 40, with follow-ups every 1 to 4 years depending on your risk factors. These exams should include tonometry to measure eye pressure, visual field testing, and OCT imaging of the optic nerve. My patient Sarah avoided blindness through routine screening. With no symptoms whatsoever, her exam revealed early glaucoma changes. Prompt treatment preserved her vision completely. Regular eye exams saved her sight, plain and simple. Step 2. Know your family history and risk factors. Having a parent or sibling with glaucoma increases your risk by 4 to 9 times. Be proactive about sharing this information with your eye doctor. Studies from the Mayo Clinic confirm that first-degree relatives have significantly higher rates of developing glaucoma. When James mentioned his mother's glaucoma during our consultation, we immediately implemented more frequent monitoring. This vigilance caught his early pressure changes before any vision loss occurred. Step 3. Follow medication regimens precisely. Prescription eye drops are the most common first-line treatment. Consistency is absolutely crucial for their effectiveness. According to research published in the Archives of Ophthalmology, patients who use their drops as prescribed have a 60% lower risk of disease progression. Create reminders, use smartphone apps, or link application to daily routines. Each missed dose allows pressure to fluctuate, potentially causing irreversible damage. Step 4. Adopt lifestyle modifications that support eye health. Moderate exercise can help reduce intraocular pressure naturally. A study in the British Journal of Ophthalmology found that regular aerobic exercise lowered eye pressure by an average of 20% for up to 24 hours after activity. Protecting your eyes from injury is equally important. Always wear protective eyewear during sports or hazardous activities. Manage underlying conditions like diabetes and hypertension, as they can worsen glaucoma progression. A balanced diet rich in antioxidants, particularly green leafy vegetables, may provide additional protection according to preliminary research. Limit caffeine intake, as some studies suggest it can temporarily increase eye pressure in susceptible individuals. Staying properly hydrated helps maintain appropriate eye fluid balance. Step 5. Understand surgical and laser options when necessary. If medication alone isn't sufficient, several effective interventions exist. Selective laser trabeculoplasty, SLT, can reduce eye pressure by improving drainage. Minimally invasive glaucoma surgeries, mmHg, offer reduced risk compared to traditional surgeries. For advanced cases, trabeculectomy or tube shunt procedures create alternative drainage pathways. These surgical options have preserved vision for countless patients when performed at the appropriate time. My colleague Robert hesitated about his SLT procedure but ultimately proceeded. 2 years later, his pressure remains controlled without drops, and his vision remains stable. Surgical interventions, when needed, can be vision-saving. Individual responses to treatments vary depending on glaucoma type, severity, and personal health factors. What works perfectly for one person may need adjustment for another. Always consult with your eye care specialist before making any changes to your treatment plan.